ಅಸ್ಥಿಮಜ್ಜೆ ಕಸಿ ಬೋನ್ ಮ್ಯಾರೋ ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟ್ ಚಿಕಿತ್ಸೆಗೆ ರಾಮಯ್ಯ ಮೆಮೋರಿಯಲ್ ಆಸ್ಪತ್ರೆಗೆ ಫ್ಯಾಕ್ಟ್ ಮಾನ್ಯತೆ. ಭಾರತದಲ್ಲಿ ಈ ಮಾನ್ಯತೆ ಪಡೆದ ಎರಡನೇ ಆಸ್ಪತ್ರೆ. ಫೌಂಡೇಶನ್ ಫಾರ್ ದ ಅಕ್ರಿಡಿಟೇಷನ್ ಆಫ್ ಸೆಲ್ಯುಲಾರ್ ಥೆರಪಿ ಫ್ಯಾಕ್ಟ್ ವತಿಯಿಂದ ರಾಮಯ್ಯ ಮೆಮೋರಿಯಲ್ ಆಸ್ಪತ್ರೆ RMHಗೆ ಅಸ್ಥಿಮಜ್ಜೆ ಕಸಿ ಬೋನ್ ಮ್ಯಾರೋ ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟ್ ಹಾಗೂ ಸೆಲ್ಯುಲಾರ್ ಥೆರಪಿ ಕ್ಷೇತ್ರದಲ್ಲಿ ಮಾನ್ಯತೆ ನೀಡಲಾಗಿದೆ. ಈ ಫ್ಯಾಕ್ಟ್ ಮಾನ್ಯತೆ ಗುಣಮಟ್ಟ, ಸುರಕ್ಷತೆ ಮತ್ತು ಚಿಕಿತ್ಸಾ ಪ್ರಕ್ರಿಯೆಗಳ ದೃಷ್ಟಿಯಿಂದ ವಿಶ್ವದ ಅತ್ಯಂತ ಕಟ್ಟುನಿಟ್ಟಾದ ಮತ್ತು ಪ್ರತಿಷ್ಠಿತ ಮಾನ್ಯತೆಗಳಲ್ಲಿ ಒಂದಾಗಿದೆ. ರಾಮಯ್ಯ ಮೆಮೋರಿಯಲ್ ಆಸ್ಪತ್ರೆ ಈ ಮಾನ್ಯತೆ ಪಡೆದ ಭಾರತದ ಎರಡನೇ ಆಸ್ಪತ್ರೆ ಆಗಿದ್ದು, ಫ್ಯಾಕ್ಟ್ ಮತ್ತು ಜಾಯಿಂಟ್ ಕಮಿಷನ್ ಇಂಟರ್ನ್ಯಾಷನಲ್ JACIE ಎರಡೂ ಮಾನ್ಯತೆಗಳನ್ನು ಹೊಂದಿರುವ ಭಾರತದ ಏಕೈಕ ಆಸ್ಪತ್ರೆ ಎಂಬ ಗೌರವಕ್ಕೂ ಪಾತ್ರವಾಗಿದೆ. ಫ್ಯಾಕ್ಟ್ JACIE ಅಂತಾರಾಷ್ಟ್ರೀಯ ಗುಣಮಟ್ಟದ ಮಾನದಂಡಗಳು ಅಸ್ಥಿಮಜ್ಜೆ ಕಸಿ ಮತ್ತು ಹೆಮಟೋಪೊಯೆಟಿಕ್ ಸ್ಟೆಮ್ ಸೆಲ್ ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟ್ ಕ್ಷೇತ್ರದಲ್ಲಿ ಜಾಗತಿಕ ಗೋಲ್ಡ್ ಸ್ಟ್ಯಾಂಡರ್ಡ್ ಆಗಿವೆ. ಸಾಮಾನ್ಯವಾಗಿ ಆಸ್ಪತ್ರೆಗಳ ಮಾನ್ಯತೆ ಮೂಲಸೌಕರ್ಯ, ಸಿಬ್ಬಂದಿ ಮತ್ತು ಪ್ರಕ್ರಿಯೆಗಳ ಮೌಲ್ಯಮಾಪನಕ್ಕೆ ಸೀಮಿತವಾಗಿದ್ದರೆ, ಫ್ಯಾಕ್ಟ್ ಮಾನ್ಯತೆ ಸಂಪೂರ್ಣ ಚಿಕಿತ್ಸಾ ಪರಿಸರದ ಮೌಲ್ಯಮಾಪನ ಮಾಡುತ್ತದೆ. ಇದರಲ್ಲಿ ದಾನಿಗಳ ಸುರಕ್ಷತೆ, ಸ್ಟೆಮ್ ಸೆಲ್ ಸಂಗ್ರಹಣೆ ಮತ್ತು ಸಂಸ್ಕರಣೆ, ವೈದ್ಯಕೀಯ ನೈತಿಕತೆ, ದೀರ್ಘಕಾಲೀನ ಫಾಲೋಅಪ್, ಫಲಿತಾಂಶಗಳ ವರದಿ ಮತ್ತು ನಿರಂತರ ಗುಣಮಟ್ಟ ಸುಧಾರಣೆಗಳನ್ನು ಒಳಗೊಂಡಿವೆ. ಗೋಕಲ್ ಎಜುಕೇಷನ್ ಫೌಂಡೇಶನ್ ವೈದ್ಯಕೀಯ ಅಧ್ಯಕ್ಷರಾದ ಡಾಕ್ಟರ್ MR ಜಯರಾಮ್ ಮಾತನಾಡಿ, ರೋಗಿ ಕೇಂದ್ರಿತ ಆರೈಕೆ ಮತ್ತು ಪರಿಣಾಮಕಾರಿ ಚಿಕಿತ್ಸಾ ಫಲಿತಾಂಶಗಳತ್ತ ನಮ್ಮ ಬದ್ಧತೆಯನ್ನು ಫ್ಯಾಕ್ಟ್ ಮಾನ್ಯತೆ ಪ್ರತಿಬಿಂಬಿಸುತ್ತದೆ. ಜಾಗತಿಕ ಮಾನದಂಡಗಳಿಗೆ ತಕ್ಕ ವ್ಯವಸ್ಥೆ, ಶಿಸ್ತು ಮತ್ತು ಗುಣಮಟ್ಟವನ್ನು RMH ಸಾಧಿಸಿರುವುದು ಇದು ದೃಢಪಡಿಸುತ್ತದೆ. ಈ ಸಾಧನೆ ಭಾರತೀಯ ರೋಗಿಗಳಿಗೆ ವಿಶ್ವಮಟ್ಟದ ಆರೈಕೆ ದೊರೆಯುತ್ತಿದೆ ಎಂಬ ಭರವಸೆಯನ್ನು ನೀಡುತ್ತದೆ ಎಂದರು. ಫ್ಯಾಕ್ಟ್ ಮುಖ್ಯ ವೈದ್ಯಾಧಿಕಾರಿ ಡಾಕ್ಟರ್ ಫಿಲ್ಲಿಸ್ ವಾಲೆಂಟಿನ್ ಮಾತನಾಡಿ, ರಾಮಯ್ಯ ಮೆಮೋರಿಯಲ್ ಆಸ್ಪತ್ರೆ ಎಲ್ಲಾ ಮಾನದಂಡಗಳನ್ನು ಯಶಸ್ವಿಯಾಗಿ ಪೂರೈಸಿರುವುದಕ್ಕೆ ನಮಗೆ ಸಂತೋಷವಾಗಿದೆ. ಹೆಮಟೋಪೊಯೆಟಿಕ್ ಸ್ಟೆಮ್ ಸೆಲ್ ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟ್ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಮಾನ್ಯತೆ ನೀಡಲಾಗಿದೆ ಎಂದು ಹೇಳಿದರು.
ಗುಡ್ ಮಾರ್ನಿಂಗ್. Honorable Chairman, thank you for being present with us today on this very eventful day. Honorable CE Dr. Nagendra Swamy, thanks for being here, sir. Dr. Madan Gaikwad, thank you for helping us through this journey. And Dr. Harish and Dr. Rashmi for helping us to scale through our journey of fact accreditation. To talk about hematopoietic stem cell transplant and also called bone marrow transplant at Ramaya Memorial Hospital. Our bone marrow transplant was inaugurated in the year 2015. The BMT consists of 5 transplant suits which are HEPA filtered and have continuous positive pressure, temperature and humidity monitoring to ensure sterile environment, and was the initial infrastructure that was inaugurated. We perform more than 225 transplants till now, and we have transplanted between the ages of 1 year child to a 69-year-old person. We offer transplants to care for everyone, whether funded through Indian government programs or private insurance or coming from abroad. Our vision is expanding access and delivering international standard care in low middle income country like India. Our mission is to provide equitable, evidence-based and safe transplant care. Under the mentorship of Professor Damiano Rondoli, Director of Bone Marrow Transplant at the University of Illinois Chicago, we launched the program in 2015 with a core team of 3 physicians, 1 coordinator and 1 hematopathologist.
Is something which is a very devastating disease. The word itself destroys the confidence of a person and a family. It is not a disease of one person. When a person gets, the whole family gets affected. Out of that, there are some cancers, especially bone marrow transplant requirement cancers, which are blood related diseases. It's very, very important for us to know the RIO, the Ramaya Institute of Oncology, which is a part of Ramaya Memorial Hospital, has a uniqueness because it is a shop-in-shop model. We have a oncology center with all the support system. Unlike any standard dedicated where you need to find a nephrologist, you have to run around, you need to find a cardiologist, you need to find here, it is associated with a multidisciplinary tertiary care hospital.
when I met Dr. Damiano about 15 years back in the US, when I was visiting university in Chicago. So I had a dinner with him, and I started understanding him and his thought processes. He was a very good human being. More importantly, he was an Italian. So more importantly, he was looking at how to serve the poor nations of giving the best of treatment. So he had gone around the world, and he went to some of the poorest countries in Africa. He went to Nepal, and he also visited some of the Far East countries. When he came to India, so that was a chance that I was able to meet him. And when he put forward that he is prepared to help us in making the bone marrow transplant as one of the treatments which was very much necessary in this country, which was not much publicized, and it was very rare to get such a good treatment. So he said that he was prepared to lend all his support. That's how the whole the program started. And I was one in that time, more than 20 years back. We took a decision that as a hospital, we must get into a place of excellence. If excellence cannot be reached, I don't think we would have served the society. Excellence is not a luxury, it is a necessity, because it gives confidence to our doctors, number one, and to the trust to the patients. These are the two things which are very important in healthcare. And this is what we have, I don't want to talk about the other things, but I would say that this is what our philosophy was to make this place of excellence. To make this place of excellence, we have to have some mentors, get into people who are prepared to help us. So that's how we got into a number of institutions all over the world. And the Institute of Illinois, they helped us in what you see today. It is their help that made us to reach this stage. We started from nil, and today after 10 years, we have almost reached more than 225.
Time with leadership and with doctors, with nurses, to develop a program that could grow. We were at the beginning having very few transplant patients, how to grow the numbers, how to make it safe, how to connect with the other people in the hospital, how to make a better diagnostic. To be today where we are with the FACT accreditation is really a testimony of an incredible work of so many people at so very high level. So I work with many centers around the world. I'm very well aware of the challenges that are necessary to get to FACT accreditation. I must say that in India, for the people who are in the audience that are not familiar with the bone marrow transplant, in India there's a common feeling that accreditation is not for India, that FACT accreditation is only for rich countries, that is only for people that have more employees. Many reasons why in India is very shared opinion that accreditation is not doesn't fit the Indian model.
300 transplant per 10 million of population. So in that regard, in India, you may know that there are about 100 transplant centers, but only about 2,000 or around that number is transplant per year, which means there is a significant gap for the need. More than 30,000 or 37,000 transplants can still occur. So having a transplant center which is FACT accredited in South India, I think provide a huge relief for patients who really can rely on quality of care. So I think this day is not only the celebration for Ramaya Hospital and the team, but I think it's a celebration for the patient who now can trust a hospital's quality system if they are undergoing transplant at Ramaya. So I think I would like to emphasize that this actually also shows the testament of the hospital administration along with the transplant team. So